Please welcome to the stage Aria Bendix from NBC Universal and our esteemed panel.
Not a big.
Good afternoon, everyone. Let's hope for a little bit less eventful panel right now. I'm Aria Bendix. I'm the health reporter at NBC News Digital. Today's discussion will focus on the role of digital technology and artificial intelligence in improving healthcare access, not just in our neighborhoods, but in areas where that access is particularly limited. We all saw during the COVID pandemic how AI helped automate scientific research and expedite distribution of a global vaccine in record time. So today's discussion will focus on how AI can bring additional healthcare services to people's doorsteps to help fight diseases like TB or diabetes. And joining me in that discussion is an esteemed group of panelists. In the center, we have Lucica Ditiu, the executive director of the Stop TB Partnership, which is a UN-hosted organization dedicated to eliminating TB as a public health problem. To my far right, we have Nick Cain, the Vice President of Strategy and Innovation at the Patrick J. McGovern Foundation, a philanthropic group that aims to advance AI and data science solutions. And to my immediate right, Nicolai Haugaard, the Vice President of Global Health Equity at Novo Nordisk, which, among other services, is the leading provider of diabetes care products. So thank you all for joining me today. Lucica, I'll kick it off with you. What have you learned from leveraging data and AI-based solutions in the fight to eliminate TB, and how could we apply that to other global health challenges?
Yeah, thank you. And I also appreciate very much having a pretty good audience here. So, in TB, we learned everything because I don't know how many of you are aware that we still have tuberculosis in the world, that it's airborne. That's the biggest infectious disease killer, and as long as you breathe, you are all at risk. And we were rather behind because till several years ago, our diagnosis and our treatment was still done in the same way as Robert Koch used to do it. So we had to embrace AI and to use it and to push it much quicker than in other diseases. So for 7-8 years already in Stop TB, we are pushing several AI solutions, such as reading X-ray, doing a mobile X-ray and then having it read through an AI capacity, and therefore not only speeding up the diagnosis, not only covering the gap of radiologists, but also a much better trained eye, to say so, because AI reads 1 million X-rays before it's pushed out there. It's important to underline that that's one of the examples. There are examples in which we can use AI to identify a cough and to see if it's a cough that leads somehow to TB or a cancer or a COPD. You can use AI to basically bring the care closer to the people and destroy that bottleneck, which is usually in the access, which is the distance, which is friendliness, which is, you cover that. So we can disrupt the space by using AI, and that's what we try to do as Stop TB Partnership for several years already, and that's what we try to do more. The last thing that I want to say is, and I hope we will go back to this, is AI not only in finding people with TB and other diseases, diagnosing and treating them and preventing, doing it early, but also an entire other part, and I think you need to do that, is in covering the gaps into data. Mm-hmm. And very often you have data collected for different diseases in the same country, and the systems don't speak with each other. So everybody has their own little program and so on, but they rely a lot still on paper. So we learned that actually the future, I know there can be another big discussion on that, is constructed on using in the healthcare and in the health system the artificial intelligence.
Data gaps is actually a perfect segue into my next question for you, Nick. We know that people often in marginalized communities don't have access to the full information about the progress of their disease or the treatment that's available to cure it. How can we leverage AI and data-based solutions to make sure that people actually have control over their own healthcare?
Yeah, thank you for the question, and good afternoon, everybody. I mean, just for a bit of context, so the Patrick J. McGovern Foundation is a global philanthropy of about $1.5 billion, and over the last 3 years, we've probably made about $25 million in grants out to partners working on these very issues. And there are 3 big things that we think about in the context of our health strategy. One is indeed data and standards. The second is products. So what are the innovations that need to happen to take advantage of that data? And the third is the capacity building that needs to happen so that the products and services are actually useful to people. Big picture at our foundation, we think a lot about what a human-centered future is and how technology can be enabling of that human-centered future. Well, all of these innovations are meaningless if the humans that want them to help their lives be better don't actually work for them. So on the data side, it's a great question. We invest significantly in standard setting. We invest in helping organizations improve the richness of the data that informs the products that are being built. A really nice tangible example, and actually for framing, a lot of the innovation is, we hear AI. For the past 13, 14 months when we've heard AI in society, we think about generative AI. A lot of the most exciting things that AI and machine learning can do are really about just making use of data, and they've done it it does it very well with old AI. So machine learning and solutions that existed before ChatGPT burst on the scene. However, to bring paint the picture a little bit in the context of generative AI, you could imagine, for example, sort of a chat-based diagnosis assistant, maybe for an overburdened healthcare professional who is getting information from a patient about their condition and hoping to sort of make an accelerated or more accurate diagnosis. We actually have a partner who started experimenting using an LLM, but a US-based LLM to support this work in India. It's done a pretty good job, but of course it does a really good job with when you use the term that is used in the United States, when you use a technical medical term that you might find in a textbook, which is likely the type of information that the model was trained on. And so the next phase, right, is to take the data that is actually more representative of the community, the colloquial language that might be used by a patient to describe their condition, and have the model fine-tuned on that information, which then makes it far more helpful to the actual needs on the ground.
Mm-hmm. Nicolai, talk to me about the role of the private sector in developing and rolling out data and AI-based solutions. What have those efforts looked like?
Thank you. Thank you for having me. I think, let me start by sharing a little bit of a learning we had at Novo Nordisk. So developing AI-based or digital solutions, taking a point of departure in what we usually do for people living in high-income countries, and then maybe a little naively believing that we could then implement those solutions in low and middle-income countries. That doesn't work. So that we have learned. But I think as a private sector, we have a huge responsibility of actually ensuring that all the innovation that we create takes a person-centric approach to it, and really understanding how can the challenges that a person living with a disease in a setting face every day, how can we translate that into building solutions that is tailored around those needs. And I think I would actually wish that a little more of companies like the one I represent take a responsibility for actually understanding what are the challenges that takes place. And we had a little bit of a conversation before going in here around how we have looked at non-communicable diseases and communicable diseases in silos for so many years. And I think the time is actually now to try and understand how can we integrate the solutions we are building around it. And then I think, honestly, we need to all come together in solving this. There's more than 500 million people living with a cardiometabolic disease today, and if we really want to change something about that outlook in terms of global health, then we need all of us on board. Mm-hmm.
I think in all of your responses, I mean, we're talking about technology, but you've all touched on that this needs to be a people-centric strategy. And Lucica, I'm curious to hear how the Stop TB partnership has sort of accounted for the diverse realities of the people and families and healthcare workers in low and middle income countries who have different, social, political, and economic backgrounds.
So this can be a topic in itself of a one-day meeting, so let's close the door and have an in-depth conversation. No, actually, we actually have a team that is focused on people-centered design. And sometimes it's very easy to say we bring people into conversation. Sometimes it's done just to tick a box. But actually, a lot of products, not in health in general, are developed, and you guys here, all private sector and so, know that developing a product, you need to look at the consumer and the user. But very often, in diseases and in healthcare, there come solutions that don't necessarily listen to the people that are supposed to use them, right? It's not very common that, guidelines are developed having in mind a lot of this input. So what we do, we actually tried to take this people-centered design to a perfection level by basically marrying the science of how you do a design listening to the needs of those using with the needs of the people in civil society and communities and people affected, and bringing them together to develop the solutions or whatever is closer to them. And it's a lot of surprise in how people see it. It sometimes is different than what we think it's easy. And we were thinking once that it might be very easy to have a tool that just tells somebody that is diagnosed with TB, you have TB, just to get the message right away on the phone. While the users, the people, potential people, users said, we don't like just that. Imagine you receive a message saying you have TB. What am I doing next, Heart attack. So it has to be complemented and so on. We have actually a tool called One Impact, which is an app that tries to be very user-friendly, and it's like more than 150,000 people using it, in which we try to use exactly what you say, the language, and to explain not only the disease, what you can do, and so on. So what we learned that we have to listen and to really get down from the stratosphere where sometimes the developers, the science, let's go to the ones that are the real ones that are suffering. And I liked, I think, what you said, that whatever is developed needs to reach the people. So if we don't do whatever it takes to ensure the access, all these new tools, being them AI or non-AI and so on, will be pie in the sky if people cannot reach them. So we should have that in the mind always when we develop something. Will this be accessible and how to people?
Equally as important to access information is accuracy of information. So I wanted to see if you could touch on this, Nick. The pandemic obviously taught us about the acute dangers of misinformation. How can we leverage AI and data-based solutions to reduce misinformation and then elevate accurate scientific research?
It's another great and important question. I think one is part of two of the pieces that have already been covered. One, what I covered around enabling models and tools to be representative and feel that they are representative of community and sort of accurate information in the community. The second is ensuring that tools come from a place where the community has defined what they are, partly because those are two things that build trust in the end in the system itself. But to your point, the information that then comes from the system also needs to be highly trusted. There are a number of exciting innovations out there thinking about ways to enable civil society organizations, health and otherwise, to take the sort of corpus of data that they control, that they've collected about their geography, community, the population they serve, whatever it may be, and feed those into systems that answer all kinds of different questions. And I think that's really important, that sort of local empowerment, because what we also know, we also do a bunch of work in the context of journalism and media. We know that the local entity is sort of, in some ways, the last man standing in terms of highest bar of trust for news audiences, and I think audiences generally seeking information about their life and context, right? And so I'm happy to talk to anyone who wants to nerd out on this, but there are a number of different approaches, technical approaches, to sort of helping your average CSO, civil society organization, take all that amazing data, truth that they know about their place and the people that trust them, and get it to their users or community in a way that makes sense to them.
Nicolai, this is a question for you, but anyone feel free to weigh in. How can we address sort of the challenges of bridging healthcare gaps in low and middle income countries? And might there also be some unique opportunities there as well?
I think there's definitely lots of unique opportunities, especially right now. I want to get a little concrete maybe on this question. So at Novo Nordisk, we took the initiative to establish an access accelerator, we call it, but really trying to work with the local ecosystems in these countries and try and figure out, first of all, map out what are actually the access gaps and the barriers, and then try to work with the local ecosystems in building the solutions. So instead of us trying to look at it from a global sphere and then trying to figure out how to go about it, we really try to do it much more bottom up. And I think that's both enabling and empowering the local communities, but it's also creating sustainable solutions because we're there by also invest into building, you can say, a workforce and enabling economic growth in those places. But happy to hear perspectives.
Mm-hmm.
Yeah, I can add here to Nicolai, and also I hope that we create a new partnership here between us. I always look for that in TB because very few really are realizing about TB, the drama, because 25% of the world is infected with TB. So hold on that, right? And it's airborne. But the future, you see, and you will hear us a lot crying for more money, and everybody needs more money into the health system. The future walked away from having vertical interventions, right? Or working for vertical diseases. Let's be a bit smarter, right? So what we were speaking also because, you know, we had to do something in the backstage, but also because it makes sense, is you see, we in Stop TB, we actually gave around 10 million grants with 2 different organizations to see how you can, for example, diagnose TB in the same time as taking care of other diseases and diagnosing early others. TB and diabetes and TB and obesity are very much linked. The prognosis of treatment is bad. Advancement from infection to disease is bigger in this situation. When people are coming to be diagnosed for TB or for diabetes, do the test for the other one and do other tests as well. And AI can help you bring this closer to people. You know, we have now the tools are so small, they can be put even in a little van. So you can go with them in areas that are difficult to be accessible. You have the climate change impacting the health system. You go with a 4x4 in which you put all the blood tests that are needed for diabetes and for other, you know. Then you put a small X-ray and you have the AI being read somewhere in the sky. Then you can do an electrocardiogram and so on. Let's be smarter and do this kind of cross investments because that's how the future should look, actually.
And then I'll pose this question to the group. Lucica, just because you mentioned sort of collaboration potentially with the panelists, what opportunities do exist for public-private partnerships that leverage AI and database solutions? Either if you have an example or you have an idea of what the paradigm might look like.
So we are a UN, but we try to work in a different way, and we are very different in not necessarily saying private sector is bad, or by saying private sector give us the money. Because we think that the know-how and actually the partnerships are taking us a longer way than just give me your pockets, both of you. We'll organize something together. So it's actually by building on each other's strengths. So, you know, I spoke a lot about the X-ray because I was very happy, like most of you, we were doing X-ray in a room, you know, you remain there naked, it's a big room, the doctor and the assistants are far away. Now it's like this, you take it in your backpack. And you have this artificial intelligence reading the results, so it's very simple to do this. So actually, it not diagnose only TB. It diagnoses everything that is in the lung. So we were speaking with the colleagues from AstraZeneca how to actually do together that we find people quicker. We find quicker TB and we find quicker lung cancer. We have similarly, as I said, all the partnership with these people that produce the smaller tools, right? Smaller diagnosis, smaller prevention, smaller treatment, and so on. There are tools to even look at the, you know, in diabetes, you need to take the treatment that you can monitor if the treatment is being taken. And then you feed into some of the data system and you can see how many doses were skipped and so on. Sky is the limit. So in terms of health, we are, I would say, Stop TB at the forefront of pushing public-private partnerships. We have a board that leads us, as many people, but we have a private sector constituency there, and we believe in this very strong partnership with the private sector. So we can share with you more of this, and I need to say one thing. It's actually not starting in the big north. A lot is happening in the big south. And people there, faced with a lot of challenges, have to embrace a lot of innovations. So actually, you know, one of the best reading AI for X-ray is from India. And then you have as well Indonesia, Philippines, a lot in Africa coming up in terms of new tools and new approaches. So I think a lot of it is really nurturing and encouraging country-level groups to come together in pushing forward these solutions.
And I know we're running short on time, but Nick, if you want to close us out.
I know we're short. I'll just be quick. I think well said. I think all sectors involved have actually a responsibility to kind of come back to some of the principles we talked about at the beginning. The standards and interoperability in particular, which is connected to another theme I think we heard, which is siloization. Another way to think about siloization is a bit of pilotitis, which is a term that's thrown around in the context of development work often. The point being things need to be viewed holistically. And as a private sector entity considers an investment, the question needs to be asked, how will this interact with other solutions in the market? How will this interact with other donors? How will this reach policymakers, et cetera, et cetera? If those questions aren't being asked, you should sort of stop at that point.
I think that's a great note to end on. Thanks for joining us today. How about a round of applause for our panelists? We head up that way.